Hello everyone. Today we talk about the USMLE Step 1, and there is our question. You can read that a 35-year-old man, 35 years old man, presents to his primary care physician, complaining of several month history of watery diarrhea. He reports that the diarrhea is often greasy looking, but never bloody. Never bloody, indicating that there's no gastrointestinal bleeding, but the greasy look means there's some internal secretion inside of the gastrointestinal system. On physical examination, the man's face is flushed. That's keywords, flushed, and his neck is covered by blotchy and violaceous erythema. I think you can refer the pictures I'm sharing with you now. See the patient's face is flushed and his neck is covered by a blotchy violaceous erythema. When asked about this flushing, the man says it has happened several times a day over the past few years, often while he is feeling stressed at work. I think stress is kind of a psychosomatic disease. And what is the most likely diagnosis? I think here diarrhea and flushed give me some clue to the possible diagnosis. Serotonin increase the serotonin in the blood system, leading to the flushing face, and inside the gastrointestinal system leading to the diarrhea, right? And then we come to mind that maybe the diagnosis is the carcinoid syndrome. Carcinoid syndrome. Well, see that let's move, and then we can see that the flushing face is because the serotonin, right? Because the serotonin inside the blood circulation, right? Because you see that the serotonin can expand the blood vessel, and the face blood system can be expanded, and then you can see the face red. But the diarrhea, the problem diarrhea is because the carcinoid syndrome occurs when the sufficient concentration of substances secreted by carcinoid tumor. Carcinoid tumor. And carcinoid tumor, most of them are kind of the neuroendocrine tumor, or secreted by the endocrine cells. And then this kind of substances reach the circulation, will bring not only flushing of the face but also the diarrhea. And these substances, including serotonin, certainly, and also their gastrin, their gastrin, and somatostatin. As we know that there's a somatostatin analog. The drug is called octreotide. okay, octreotide that can be used for pancreatic tumor as well as the carcinoid tumor, okay, if the tumor cannot be surgically resected, okay, or can use the conservative treatments. First, make use of the octreotide, then to do the surgical resection. And also other substances like substance P, okay, substance P, okay, substance P, and also there's a vasoactive intestinal peptide, VIP, and also the pancreatic polypeptide histamine, okay, polypeptide histamine, or the chromogranin A, okay. So the chromogranin A is the diagnostic marker for carcinoid tumor, as well as the neuroendocrine tumor, okay. And so this substance is secreted by the carcinoid tumor, leading to diarrhea, okay. But you see, I would further talk about the serotonin, and then there are 20 necessary amino acids for a human body. One of them is tryptophan, okay. One of them is tryptophan. And tryptophan can be degraded into two ways. One is serotonin, okay. One is serotonin. And as we know that serotonin can be degraded or metabolized into the 5-HIAA, okay, and HIAH for hydroxyl, I-indole, A-acetic, A-acid. So 5-hydroxyl indole acetic acid. And then 5-HIAA can be found in urine, okay. So that the 5-HIAA in the urine can be regarded as the diagnosis for the carcinoid syndrome. And the second pathway, second route for the tryptophan is to metabolize into the niacin, okay, niacin, or called vitamin B3. But since you know that the most of the tryptophan will be metabolized into the serotonin, so generally the production of the niacin will be decreased. So in this way, that if the patient lack of the vitamin B3 or niacin, it will lead to the triad. One is the diarrhea, certainly diarrhea, lack of diarrhea. Second, will lead the skin rash or dermatitis, okay, skin rash. 3, and even the dementia, okay, even dementia. So we can see that the dermatitis and the diarrhea can be also found in the carcinoid syndrome, but the dementia is only for the vitamin D deficiency. So the 3 syndrome or triads can come to a disease called pellagra. Okay, pellagra. And then you can see the pellagra, the picture. I'm showing the picture of pellagra here. So as a doctor, when you come to the patient with carcinoid tumor or carcinoma or the syndrome, it is good for you to recommend the patient to supplement the vitamin B3 or niacin, okay, because it is deficient in vitamin B3. And how to how to treat the carcinoid syndrome. If the localization of the discrete carcinoid tumor is possible, and then certainly we got to do the surgical. Okay, got to do the surgical dissection or resection. Okay, do the surgical resection to remove surgically. This is the optimal therapy. But for other cases, symptomatic management with this one with the somatostatin analog or octreotide. Okay, use the octreotide will be the most beneficial. Okay, so that's all for this edition. And then thank you for watching. Bye.